Center of Sustainable Development. Zone 72 Youth Program is in collaboration with the South Sudan Ministry of Health, South Sudan Nurses and Midwives Association, Shabab Le Shabab, Canadian Association of Midwives, and UNFPA. Zone 72 is made possible with support from Global Affairs Canada. Well, to comment on today's program, you'll be calling us on our studio lines, that is 0911 or 0922 986 986. And for text messages, you can send to 0913 986 986. You can also stream this broadcast live by logging onto our website, that is www.iradio.org, or on our Facebook page, that is iRadio. You can as well stream this broadcast on our YouTube channel, that is iRadio South Sudan. If you have questions about adolescent health, send us an email to youthzone72@gmail.com or call 0922 009497. We also have two hotlines and they're toll free. If you want to report on GBV, you can call 623. And if you want to report issues on adolescent health immediate, you can call 885. Today we are going to be looking into a very crucial issue, and that is child marriage, which remains a significant issue in South Sudan, with 52% of girls married before the age of 18 and 9% married before 15. The practice is driven by poverty, gender inequality, and cultural traditions, where marriage is often seen as a way to secure financial stability or social status. In many communities in South Sudan, girls are considered ready for marriage once they begin menstruating. Well, despite legal frameworks such as the Child Act of 2008, which sets the minimum marriage age at 18, enforcement remains weak and child marriage continues to be widespread. And I'm glad to have with me in the studio two guests who will be shedding more light on our today's topic. I have with me Oyela Josephine, who is a project officer for sexual reproductive health and rights and GBV with Amref Health Africa. I'm also happy to have with me Dr. Gordon, the Executive Director of Men for Women. Good evening.
Thank you. Good evening.
It's good to have both of you in the studio. Going straight away to our discussion, let me start with Oyela Josephine. Can you give us an overview on the status of child marriage in South Sudan according to your own observation?
Thank you very much, Baria, and thank you for hosting me here. Once again, I'm Oyela Josephine. Concerning the status of child marriage in South Sudan, according to my observation, it is a rampant practice that is mainly geared by poverty in many communities and need for a family to acquire a living, sometimes also to acquire prestige. You find someone giving out a daughter in return for many cows, many wells, and all this etc. It is actually a rampant practices, and some of it is in other areas, the context varies. In some areas it is instigated by parents, while in other areas it is by the children themselves, and sometimes it's because they lack information on their sexual and reproductive health, and also they also lack information on how to care for their bodies, and also the same way need for other materials. As we know, poverty is one of the most important causes, and because these children sometimes they need school materials, they need pads, they need soap, they need pens, all etc, those small things. So it makes them give in, like, if I accept this man, he has money, he has a shop, he writes border, he's capable of giving me money. So that's what it is.
Okay, yes, Data.
Thank you so much. And just to lament on what Oyela said is that there are many factors, and I just want to pick one thing from the Pojulu Cultural Festival. And I remember one person categorizing the kinds of marriage within the Pojulu culture. And one marriage, of course, is when you met someone. And we all know within South Sudan is the sexual debut age. By sexual debut age is the age where someone starts to have sex. Is estimated around between the age of 13 and 14 years is where you find that this kid starts to have sex. And within that, this is also one of the ages where someone, a girl possibly starts to menstruate. And if a girl, just like she said, doesn't have the information to be able to know to manage issues of safe sex and all those stuff, and even a boy does not have that information, you find that this boy unintentionally or intentionally impregnates a girl, and then you find that because there is this thing of we don't want shame in our family.
Yeah.
You're pregnant, you need to go to whoever impregnated you, whether you're underage or you're above age, you have to go. And that contributes a lot to child marriage, and you find that this person is forced to go and get married to also a child, or even someone who is an adult, but of course he's a child. So that alone contributes a lot to child marriage. And of course, statistics shows that within South Sudan, more than 50% of most of our mothers got married below the age of 18 at that age. So it's quite a rampant scenario, and just like Sisa highlighted, those are many of the key factors. But of course, some of the key factors, of course, is political marriage. You find that I know I will want to get alliance from a specific greater community or what, I will definitely give my child off for marriage, so that when I go there, I have that political leverage. So there are these political marriages that happen. It's not just because of love, but because of politics that we unfortunately such things happens.
Okay.
Yeah.
And also, Oyella, how does child marriage affect? Let's look at the health and well-being of the young girls.
All right, thank you very much. Once again, this child marriage, actually, I forgot to estimate the percentage. It's 52% in South Sudan. We know very well child marriage. These children are children below the age of 18, and anatomically the bones under 18 years, the female bones, even the male bones, they are not yet mature. But in this case, the female bone is more important because this is the woman who carries pregnancies and will undergo deliveries, giving birth. Yeah, we see when a girl is married below the age of 18, her bones are not yet fully matured enough to accommodate the fetus during deliveries. Actually, we find when she gets pregnant, she's at risk throughout, during pregnancy and during childbirth, and even after delivery, she's still at risk. Once she gets pregnant, luckily she may carry the pregnancy to term, and then during deliveries, considering the poor health system of South Sudan, she might not be having access to good health facilities, because we have levels of health facilities. We have these primary health care units. This one, someone can deliver there without complications. They also have either enrolled midwife or sometimes also registered, or community midwives are there. But these ones, apart from receiving babies during normal deliveries, they will not do further on that. Yeah, so having this, we also have these cultural barriers whereby everyone is said to what? Let me categorize them. Actually, we have the 3 delays. This one will affect this girl so much more than a mature woman. One is she will not access health service because of cultural barrier. This is one. The family decision maker is not there, also because of inequalities in the family. If she's married, she will have to wait for the husband to make a decision that you go to the health facility or not, or the mother-in-law or anybody in the family. So that one puts her at risk of delaying to seek care because of cultural factors. 2 is economic factors. She may have, they may make that decision to go to the health facility, but they don't have the finance to get the means of transport to go to the health facility, or the health facility might be very far with poor roads, vehicles cannot move. They may not get the motorbikes to go there. They can be footing, and they're already at risk of this, or they may not access the health services at the right time. Then 3, the health facility factors, where now they might have made the decision, they might have found the transport to reach the health facility. So in the health facility, do we have the equipment to save this mother who has come? She's already in the second or third stage of labor. She wants to give birth, but she has failed. Of course, in all these levels, she's being affected. The labor is progressing. She has to, the body is in a way that when the time comes, the uterus no longer wants to continue to accommodate that fetus. It has its own mechanism of expelling, and this is a child. She has not fully matured. So in the process that the uterus wants to expel the fetus out and the pelvis is inadequate, the fetal head, the baby's head is going to stick inside the lower part of the uterus, or sometimes when it goes lower, and then in that time, when we are running, maybe they have reached at the health facility, we are looking for the surgeon. Maybe it is because now it is a primary health care unit. She has come late because of all these factors and all this. They are still going to transport her to the CIMOC center where they can do operation. So all these delays is affecting her body, in that the tissue between the head of the baby, in the vagina, and then the bladder, because the vagina is between two organs, the bladder in front and the rectum behind. So during all these delays, the fetal head keeps pressing on the bladder and from behind on the rectum. So the tissue between the vagina and the bladder keeps dying, and there is also the tissue between the rectum and the vagina may also die. So it creates a whole abnormal communication between the three tissues now, three organs, the vagina, the rectum, and then the bladder. So this one will contribute to a condition known as fistula. So in this, it is two types. We have the rectovaginal fistula. This one occurs when the tissue between the vagina and the rectum dies, and there is a hole developed there. It communicates. So this one present with somebody will also keep excreting feces. The feces will now come through the vagina because it is open. Whenever it reaches the rectum, it comes to the vagina also. And then there is the other one, vescovaginal fistula, that occurs when the tissue between the bladder and the vagina dies. The urine also will be leaking through the vagina, and any amount of urine that comes to the bladder goes out uncontrollably. Even the feces comes uncontrollably. This person doesn't know, but it is coming. When the outcome is really, really devastating. Imagine someone smelling feces, smelling urine every time, you can't control. So this is all attributed to child marriage. When we give in our children for marriage and they are not in that age, we are predisposing them into these risks of getting fistula and living with shame for the rest of their life once intervention is not taken. Thank you.
Okay, yes, Data, you want to add something?
No, she has quite elaborated well, and I just wanted to highlight key things, key statistics within South Sudan. Of course, looking at the adolescent birth rate ranging at the rate of 158 per 1,000 live girls. 1,000 girls is the adolescent birth rate. That means within 1,000 girls, adolescent girls that give birth, that get pregnant, 158, of course. That is the birth rate, 158 out of 1,000. But of course, there is also the aspect of teenage pregnancies. We have around 300 out of 1,000 teenage girls get pregnant, which is quite high, extremely high. And that's why, based on what she has explained, is that it leads to the issue of obstetric fistula. Al tamabag there are of bulgija wele karagija bes tagija kalas yani rihagija rihata bulu wele rihata ta karagija. That is a big issue that is happening, and estimated about more than 60,000 obstetric fistula women with obstetric fistula cases happening. But good thing is that of course we have interventions. It's not like magaleani amuleta hajata maji wele sunu la. It's something that is medical and it can be treated.
Okay. Also, Data, how effective are the existing laws, for example, the Child Act, in preventing child marriage?
The Child Act is not that effective. And And I just want to highlight a key thing. I don't want to get into the real nitty gritty of the example, but a case study happened recently where there was a bidding for a girl child, and this bidding happened in the face of legislators, in the face of government, in the face of the judiciary, in the face of even the local authority and all citizens. It was an open thing where the father was saying the daughter was 19, but the mother was saying the daughter was 14. And at the end, of course, is that there was nothing literally done. Everything went on the cultural angle. We have the Child Act. Yes, it talks about any person below the age of 18 is not for marriage.
Yeah.
But we have manipulative behaviors within our systems. And I just want to say, to be specific, within our traditional systems. So he talked about, if he gives me more cows, because I'm going to have wealth and I will be wealthy, why do I have to wait? We've had a scenario a few years ago where even a deputy governor was one of the contender of a case that involved someone reported to be underage, right? The bidding process and everything. And what happened? The deputy governor was never taken to court. And those are loopholes. Not loopholes, but those are gaps within the implementation of the Child Act, the rules governing issues of child marriage and all those stuff. It's quite unfortunate that even within the government, we have loopholes. Within the government, we tend to sit behind and say, it is culture, and we don't take it. Yet we know that within our laws of the country, they are supreme to any other law. The Child Act is derived from the Constitution, right? And the Constitution is the supreme law of the country. No any other law, whether traditional law or whatever, can be able to surpass our Constitution. But unfortunately, we tend to look at, if it is a child marriage case and it is taken to the traditional courts, it's a cultural issue. If it is taken to the statutory courts, then that's when now the government comes in and takes it all. And that is where within the Constitution we need to be able to define the supremacy of the Constitution over our traditional laws, so that we define what can be handled within the traditional laws. Kantagrafi masalan kator bikot sunuya yani the people within there, the judges within Kator B Code should be able to handle the cases, and then what other cases are supposed not to be handled by them. That needs to be defined clearly within the Constitution. And I'm happy that we are talking about the Constitution making process, and that is where things comes in. So the Child Act is there, it has the laws, but unfortunately we have the sickness of lack of implementation of our laws.
Okay, yes, Ayala.
Yeah, thank you so much. I think he has elaborated more on this because the implementation of the Child Act is very weak. As he said, it is it's ineffective. And this is why we have now rampant cases of child marriage, because people do not have respect for the laws that protect children. Even I have an example whereby a child protection a director for child welfare impregnated a child. He was taken to court, charged, but he did not
go to prison.
He did not go to prison for the number of years stated in the laws. So this one is really contributing to a number of crimes against children. But I feel like this can also be dealt with in some ways. Because in the community, for example, what Gordon was saying, like to spell out Child Act very clearly in the Constitution, and also at lower level, at community level, they can also do that. I remember we did one bylaw for Yambio County, whereby they have stated the levels of management of those cases, levels of adjudication, and in that bylaw, judgment over child marriages is clearly stated. It belongs to statutory court. It's not for B court. It's not by headman. It's not by a chief. It's not by anyone. It is to be presided over by the judge. So there are a number of them: cases of murder, cases of child marriage, forced marriage, and all that. It's rape. It goes directly to court. So that side, it is spelled out very clearly, and I'm happy some of them are now referring those cases all. But we have challenge at those mid levels, of which if it is done as he said, I know things will move out well.
Okay.
Thank you. Yeah.
All right. Thank you. Yes, Data. Let's look at the effect that also child marriage has on the education aspect and also opportunities for these young girls. Because I used to observe back in the days when an underage girl gets pregnant, there is not much support from the family for her to go back to school. So she will end up like that, and maybe now the focus will be moved to either her younger sister, one that does not have a child. But nowadays I can see that you will see teenage moms, they go back to school. There is some support from some families. They can take care of the child and you can go back to school. But what impact does it really have on their education opportunities to these young girls?
Thank you so much. And just I want to derive from the fact that at least teenage mothers or pregnant mothers, girls or women, have opportunity to go back to school, and came after, of course, several advocacy. And then I remember then National Minister of General Education and Instruction, Honorable Awud Dengachel, she had to sign a policy within the ministry that permits every single girl or a woman who is pregnant to still go back to school. And that gave a leeway. And by the way, within the South to South network, where I am also a member, is that not many countries within Africa permits a pregnant mother to go back to school. Not many. South Sudan has been one of the exceptional countries that has been permitting, and many countries were learning from South Sudan, and many wants to learn more from South Sudan. And that for me is something that we can be able to promote, that even if you get pregnant, we have unintended pregnancy that comes in. You did not plan for it, but it comes in. Does that need to deal away with your education? No, it doesn't need to. You still have an opportunity to go back to school, sit for your exams, sit for your classes without any stigma, any stereotypes, anything. You need to get that education. But of course, now getting to the impact, there are a lot of impacts that comes in with issues of child marriage, especially when it comes to education. One thing without policies is that you find that the girl child drops out of school. And when the girl child drops out of school, meaning opportunity for education is done, opportunity for even now issues, let's say the aspect of economic empowerment is done, opportunities for any other thing, like anything is done. You're redundant, you just wait to give birth, you go for antenatal. If you have the opportunity to, you don't need to. So these are certain things, these are unfortunate impacts that happens to the girl child. But again, there are health impacts. She mentioned one, obstetric fistula, where she has described into details. But again, the girl child does not even know that I need to go for antenatal within this period of time. If I go for antenatal, I need to be taking this kind of medication within this period. In case the baby kicks this side, what happens? What is the issue? She does not know. And even during childbirth, she doesn't know. Sometimes you find that many of these girls, you find Hajal Genadigali Moyo, the water will just Moyo Faga. They will not even know that what that is. You get it? Even after giving birth, when a child is crying, they don't know this child is crying because the child wants porridge, milk. or this child wants maybe there is something paining somewhere, they totally do not know. And that is because of a few other aspects, because this is a child. And someone I know will later on call, but our mothers used to be this. Our mothers were trained differently.
Yeah.
And our mothers, most of them were above the age of 18, and they learned these processes. And there are cultures where sometimes our mothers will have to go back to their families. They give birth in the presence of their mothers or their aunties, and then they are trained on that. But not that when they are a child, then this happens. So these are some of the key negative impacts that happens to the girl child. Another impact is a girl child will say, I did not intend to have this baby. Maybe I was raped. And they'll be like, Dejana sukar o maro hajadel. Bes weledu jibule na jana tagiri jawara fe madrasa wala hajataki. You know, we tend to undermine the girl child when the girl child speaks concerns that affects her. So those are key things that generally happens and affects the girl child. And for me is that these are some of the key impacts that affects the girl child. Yeah.
Okay. Yes, Oyela?
Yeah, thank you. Just to add on what he has said on some of the impacts of this child marriage, we've seen maternal mortality, morbidity and mortality. These are young children when they are married, and the husbands will need them to produce children because they have paid cows. They will not wait that you make 18 years, make 20. No, they will be expected to have children. So these are the people who are at risk of diseases, because even pregnancy compromises their immunity. They will be having constant infections, even with malaria, all the adverse effects. They can also have miscarriage or if they manage to carry the pregnancy to term. The children also, we've seen in hospitals, children of young girls are the ones who are dying always because malnutrition, malaria. The parents a child cannot take care of another child and all that. And also this maternal mortality, we've seen if this child who is married and she's still young, she gets any severe conditions. We have hypertension. Is very common. Eclampsia is very common in underage during pregnancy. So these girls can die from any of these and other diseases. So they are at risk. We have I've already talked about the child of this adolescent dying because of poor care, malnutrition. Some of them even they are married to their fellow children, so they don't have anything. They are not employed, even working physically like in the garden. They are not able. They are still being cared for by their parents. So they are at this high risk. And this woman is also at high risk of malnutrition because she's not eating well. Nobody is feeding her. Yeah, and also socially, she's not going to be okay. At home, she was a child. This child where the mother cares for her. If she has problems, people care for her. But now she's married. Everyone considers her a woman. She has no one to explain her problem to because she's considered an adult, and this is affecting her mentally and psychologically. We also have stigma when it comes to the side of let's say the girl has carried already pregnancy and she has given birth. Maybe we say that she's going back to school. She's not going to be the same like other girls. People will be laughing at her. They may call her Nafrang, Nafasa. What in class there? You're not going to be happy like the rest of the people. So these are some of the impact on the girls and even on their mental health. There is what we call pueropsychosis. A girl gives birth and there is no proper care because after birth there is this mood elation. We call it baby blues. It progresses with the more poor care you have, the more you progress to other stages of pueropsychosis. So these are the girls, the women, these young children, they are the ones at risk of pyperopsychosis because of poor care. Some of them do not want the baby, like when my colleague said here, it might be a product of rape. So seeing this baby will be tormenting her, and immediately she can get psychosis after birth. So these are some of the effects of child marriage.
Okay. All right. Thank you so much, Oyela. Our broadcast time is 31 minutes past the hour of 4. Yes, مستمع أي رجل نقول سكلام تا child marriage أو زواج تا أطفال. سو كان عندي سؤال ضيفتنا في داخل الاستوديو، ممكن تبدو لنا تليفون في 0911 أو 0922 986 عشان تبع صدمون السؤال تكي. And those who are watching us live on our Facebook live stream, you can drop your questions and your comments there, and I'll read them later on to our guest in the studio. Data, I want us to go back to the point that you raised, whereby a pregnancy can come as a result of a rape, and what long-term impact does this have on families and communities? Sometimes this girl is raped by someone from around the family. It can also happen from the neighbor, or there are scenarios that even the person who raped the girl is renting in the same compound. So maybe the families will not bring that out because they feel like it's a shame, or sometimes so what long-term impact does this have on families and also the community as well?
Okay, thank you so much, Baria. One thing that we need to know is rape mostly happens it's usually inflicted by people we know. It's not mostly people we do not know, unless we talk about rape during conflict.
Yes,
that's when these are people we do not know. But if we build most of these people who come to rape our girls, our daughters, our sisters, our mothers, these are people mostly we know. And they come, that is why in most cases, Yani, we advise, for example, parents, if any other person comes in and you have a daughter, this thing of, I have been here for like sitting on the laps of the, no.
It's wrong, yeah.
You're not advised to do that. You should be able to tell your daughter and even tell this person that, no, I do not condone this. Not because you are a rapist, but because I do not want like my child or my sister or whatever to be exposed to this, because that is how things happen, right? And just a key example, there is a movie which was directed by Wanilo Kulang, and I remember UNFPA had an opportunity together with the National Ministry of Gender, Child and Social Welfare to broadcast this movie in schools and in communities, and this movie clearly showed who the rapists are. These are people we closely know. These are people, for example, she makes tea by the roadside. I come frequently to take tea. I am a high suspect. Not everyone, of course, that comes to take tea is a suspect, but I am a high suspect, and this is someone that definitely I'll be able to do that. So unfortunately, these are people we closely know. And that means as parents, as guardians, we need to be very keen on who comes to our houses, to our families, to our homes, because these are possibly people who are going to be inflicting such pain to our people. Now, we have impacts, short-term, long-term impacts. Of course, if I know, let's say, this neighbor is the one who raped my kid, right? And because of shame that she's possibly pregnant or she's going to be pregnant for this, because I do not have the information that once my child is raped, within 72 hours, very important, I need to go to a medical facility. For key reasons. One reason is to prevent unintended pregnancy. So that we do not have a long-term impact in terms of a child as a result of rape. That is one. But secondly is we also need to make sure that we do not know the status of this rapist. This survivor needs to be taken to the medical facility to access medical services, for example, post-exposure prophylaxis. you are raped by someone you do not know their status. It's important for you to be able to be enrolled on post-exposure prophylaxis for a number of days. So that in case that person is HIV positive, you have high chances of not contracting the virus within these 72 hours when you're enrolled on these services. If you have any other bruises, any other injuries, what you can also be taken care of within this. But above all, she talked about mental health. Issues of psychosocial support will come in, issues of mental health will come in, but in case you want to take this case into a legal case, you have evidence because you have gone to the medical facility, you have collected evidence, you have the form 8 or form 9? Form 8. You can definitely go to a court and the suspect will be apprehended, charged in court, and definitely within court you become victorious. Now, the issue is this. Within our families is that there is definitely going to be that self-stigma. I am raped. How is my father, my mother, my siblings, or my brothers and sisters looking or thinking about me? It's a long-term impact that definitely affects survivors. And of course, the other impact is in case I do not have, as a parent, I don't have the information, and my child is raped, and unfortunately she becomes pregnant. She gives birth, she gets pregnant, and she gives birth to a child as a result of rape. Unfortunately, we do not know the rapist, right? Now, first of all, we start calling the child using names. Like different names, stigmatizing names within the community. And this child starts to, of course, grow. And you know, most children will want to know who their father is, who their mother is. And that will torment not only the mother, but also the other people within the family, and also the child. So these are some of the key impacts that usually happens within our communities in terms of issues of rape, issues of child marriage, and many others.
Okay. Yes, Oelle, you want to add something?
Yeah. Thank you, Gordon, and thank you. Okay. Yeah. In addition, just he has already talked of the mental part of it, and we are happy that we have those psychosocial services. Had it been that okay, for those who cannot accept this, access these services, they are at risk of what we call post-traumatic stress disorders, where you find this person will not heal from the past or from what happened. Every time the person keeps memorizing, and it is hard. She may not again live a better life. She may not get married again, or she may have behavioral problem where she resorts into hypersexual activities, getting in bed with anyone. It's because of what happened before. But if this, if she's handled with care and psychosocial support provided, the family accepts her and keep counseling, keep standing, we are with you, and all this, you find that slowly by slowly she forgets without blame, because blame is the one that brings all this. And why the person gets these disorders is maybe because of self-blame also. Maybe I wouldn't have had this, I wouldn't have done this if I didn't do this one. And then also the children who are product of rape, other than calling them names and all this, the family, the people usually look at that child as the rapist. To make it worse is if that child is a boy. All the hatred that should have been for the rapist is transferred. There is transfer of anger, which will be on this child. And the child will not live a happy life. At the end of it all, may go to the street, become a street child, because there is no one loving him or her at home. So that's the long-term effect of this rape.
Okay. Yes, Datha, let me come back to you. What are some of the challenges that activists or organizations face when they are advocating for the enforcement of the anti-child marriage law, or just raising awareness about child marriage, either in communities or anywhere? Are there challenges do activists face, or even the organization that is carrying out these campaigns? Do they get rejected by some of the communities around the country?
Yeah, there are many challenges, and one key challenge is that we've just highlighted is that the Child Act is not fully implemented. That is one key challenge. The second challenge is that the Constitution does not. The Constitution recognizes, yes, the traditional laws, right, but does not define where the traditional laws have to end. Like, for example, when you go to courts, what is it that they are supposed to do and what is it that they are not supposed to do. I'm happy that in Yambio there are bylaws that are there, championed by the local communities, and they are owning it. Ownership is very important. So that for me is also a plus in a way that the Constitution needs to come out very clear, define what is it that can be done by our cultures, the traditional laws, and what is it that cannot be done by that. And that is a gap that is missing, because the Constitution does not define a marriageable age. Within the Constitution, it's not defined. We only look at the Child Act defining a child is anyone below the age of 18. And you cannot marry someone below the age of 18, or for someone to marry below the age of 18. But if it is reinforced even within the Constitution, it becomes key thing. Of course, and that brings into the gaps within our legal systems. There are gaps within our legal systems, and you find that within the legal systems, the fraternity issues of courts is that we have the anti-GBV court in Juba. We only have a few mobile courts outside Juba that are supported by humanitarian partners. They are supported by humanitarian partners, yes. It is implemented by the government takes lead, but we want something led by the government, right? Led by the government, and it is fully done by the government, because I'm a humanitarian partner. Sometimes I have my own interests, and I can manipulate things, right? But I'm not saying all does that. So these are key things that definitely happens within the legal fraternity. Again, is that there is the lack of, limited knowledge about available policies, available laws within our communities or our citizens of South Sudan, right? Someone might have only known the traditional laws, but does not know the statutory laws, right? This person will have gone to the statutory laws, but because he or she does not know the statutory laws, he goes to the traditional laws that at the end does not give the right judgment based on his or her needs, or based on what has really happened on issues of rights, privileges, and all those stuff. So these are key other factors, of course, that affects issues of child marriage in South Sudan, implementation of these policies, and even within the lawmakers themselves. I'm not saying all lawmakers do not have the knowledge, but I believe there are those who really do not have the knowledge when it comes to issues of the law. Issues of because I'm being appointed on party list, I am to serve the interest of the party. And I keep saying this. That is one key reason why until now we do not have the anti-GBV bill passed. Since 2020 or even before 2020, we have the anti-GBV bill. Why is it not passed? Why is it not a priority? It is an issue within, I remember during the 2019 commitments of the ICP, the International Conference on Population and Development, and by that time it was His Excellency General Taban Dengai, who was the first Vice President. He signed the national commitments, and then one of the national commitments is passage of the anti-GBV bill in mid-2020. We're in 2025. It is not yet passed. What is not happening, right? So these are set key factors that affects the implementation of laws and policies within. And I mentioned an example that there are even government officials who are participating in issues of auctioning or competition for a bride. And this bride has disputed age bracket, right? And nothing is done to these constitutional post holders. So these are key challenges that happens.
Okay. Yes, Josephine?
Yeah, thank you very much. he has highlighted most of the challenges that we have in advocating for, against child marriage. In some parts of the country, there are a lot of resistance where people say, it is my child. What do you want from the child? But all this is attributed to lack of knowledge, lack of awareness on the existing laws. If they knew, they would not reject this kind of initiatives. But in some parts of the country, they have embraced it, like in Western Equatorial States, for example. They are happy when you come with initiative. They even come to inform you about the cases of the extent of child marriage in their communities. They really need those intervention. However, once child marriage has occurred, there is a very important challenge that should actually be noted and should be taken care of. Advocates always have threats from perpetrators. You find that some perpetrators are members of armed forces. So if a son of an army commander impregnates a young girl, and who are you to go and put him in prison? He comes with a gun, bring my son here. In Iba County, it happened. So they had to remove his son and give back, because even the authorities there, they lacked protection for themselves. And even in town, the legal advocates, the advocates, they always have problems. Recently, even lawyer at the One Stop Center, he complained that the perpetrator is coming to court with gun and he's afraid of his life. So these are the challenges. You find a perpetrator now puts the life of an advocate at risk, and over his mistakes that he has made, instead of admitting and maybe asking for compensation, let me compensate, let me do this, but still is having aggression on this. So this is a major challenge that is actually everywhere, and it is one important factor. Others can be dealt with, but this one is beyond everyone. Even an NGO cannot do anything about this. Thank you.
Okay. All right. Thank you so much. Let's pick this call. iRadio. Hello, iRadio. Okay, you can still call us back on 0911 or 0922986986. Ita lisa baki da rija dugu lana telefon fi 0911 au 0922986986 annabon su kalamta child marriage au zawaj bita atfal. Let's go through some of the comments on our Facebook live stream. We have Akej Deng. He says, I'm watching live in Juba. We have Teachers Without Borders Association. They says, well articulated, children are the future to be nurtured, but not wives to be married off to get wealth. Thank you so much. We have Matata Ayudian. He says, good evening, iRadio. I'm watching you live from Kenya. We have Data Charles. He says the future starts today, whether boy child or girl child. We all deserve to see tomorrow by our own selves. We are the future. We are the generation. All right. Thank you so much. And we have Sam Lual Adong. He says, I'm watching live in Juba. The girl child education must be prioritized by our government. National Legislative Assembly need to pass the law to protect underage marriage and review our cultures to eliminate the bad cultural aspects, like depending too much on a girl child as a source of wealth. Okay, thank you so much, Samuel Lual. And we also have William Sabah Daniel. He says, I'm watching you live from Mauna. Thank you so much for your comment. And we have Peter Nial. He says, hello, iRadio. Call me Peter Nial in Boardtown, Jungle Estate. What let child marriage happen is always, it falls under the following causes. He says poor cost of living, poor parental care, and influence of culture. All right, thank you for that. We also have Michael Fabiano, and he says, hello iRadio. My greetings to the guests in the studio. Early marriage is really so many in our community. Some are due to economic crisis, where a girl does not afford her personal needs. Because of that, she ends up accepting marriage from someone whom she thinks will be able to provide her needs. My question to our guests in the studio is that, what are you doing at your capacity to reduce unemployment among youngest girls in the community. Call me Michael Fabiano from Yambio. All right, thank you. We also have another comment from Akech Deng. He says, hello, iRadio. I'm watching you at Juba Teaching Hospital. I appreciate the guest for the nice advocate and sensitizing the general public to end child marriage and gender-based violence. We have Chris OTC. He says child marriage has to stop. All right, thank you so much. Thank you all for your nice comments. Let's pick this call. Yes, iRadio. All right, so you can still call us back. We have a few minutes before we conclude with our program. So 0911 or 0922 986 986. And when you're calling, make sure your radio is off or you move away from your radio so that our guest can get your question or your message very clear. All right. Yes, data. Okay, let's pick this one. iRadio. Hello, iRadio.
Hello?
Yes, marhab.
Good evening.
Yes, you're welcome. Good evening.
Okay. I'm happy.
Tell us your name and where you're calling in from.
I'm calling from Juba. I'm Malahas.
Okay, what's your name?
Yeah, I'm David.
David, you're welcome.
Okay. The issue of child marriage is depending on the parent. First, when you have good administration, then the child will follow well. And then also we have these days which are spoiling the children, this pornographic. The children are watching those things and they want to copy. And that is other thing. The parent is here at home, but the child is learning somewhere. This is where the child will go and mess. Hello?
Yes, we are getting you.
Yeah. So those are other things to be regulated from the children. Not especially the parent also should monitor the phone of the ladies. You will find that they load these pornographic films where they are going to practice after now they mess. It is also need also put in line so that to prevent child marriage in future. And then also the parents should make sure that a lady should be in a school, because the child, when it is not in a school, which means it will go where it will not be in good way of life, and then at the end it will make that one. Thirdly, as being a lady, it should not be always sit where among boys. Because they say when you sit near the hill, you will become brown like a hill. So what they prevent is you may correct those ones. When you come up the law, other thing goes to the law, it is now too late. But first start from home when you teach your child well. Teach about the bad thing and the good thing. You will know this is bad, this is good. I end there, thanks.
Okay. All right. Thank you so much, David from Haimalaka. Data or Josephine, you want to maybe comment on what he said?
On the issue of parenting mostly. Yeah, thank you very much, the caller. On the issue of parenting of children, it is a challenge actually, whereby we find that most parents are now working parents. The children are living at home with maids, with relatives and all this. Yeah, but they are also trying. And if we also look at in this case, we find that the children also who are actually getting early pregnancies, they are also not from these families that are living with maid. Most of them, they are from families that are living together. They are from their parents. Both parents are together. Yeah, but we find there is a challenge in parenting nowadays where parents do not teach their children. Some of us, when we were growing up, or our parents, every family has its rules. For example, there are certain things that you are not supposed to do. Even when you are packing your things and you're going to school, to a boarding school, your parent has talked to you from home. Trust me, you are going to school, you will stay putting what your parent has told you in your mind. Whatever people are doing there, you say, my mom, my dad told me it's not for me. I'm not supposed to do ABC. And you find that with instruction, proper instruction and guidance from parents, children are able to keep themselves and to adhere to the rules at home. Even at home, when they say that by 5, you are not supposed to leave home. You will not leave home. Yeah, but most of the things are also coming from us parents. You know, you are a parent of adolescents and you don't come home. By 6 you are not there, 7 you're not there, at 10, 11 you're coming home when they have slept. Morning they are going to school before you wake up, you're going for work, you come again, they have slept. Where are you? What is your role in educating your children? So even for us who are in the village, we are cultivating. We waste a lot of time as parents. We are staying at the roadside, taking coffee, taking what, instead of maybe making the coffee at home, you take and you're talking to your children at least. So you find even parenting is a problem. People left their children. There is permissiveness in most of the families. A child goes wherever they want. It may learn that people are nowadays moving to birthday where they come at what time you don't know. What happened to them you don't know. After how many days you find that the child is pregnant. From where? Is a person, a neighbor, is a person that they went with to the other birthday. It's ABC. So parenting is really a challenge, and I would like to appeal on his voice that let every parent at least try to bring their children, keep them at home and give them instruction, and also not forget to educate them about their bodies, how they are growing up, what changes happen in their bodies. And if for example, if a girl has started menstruating, she should be knowing anytime she has sex, she will get pregnant. Anytime she has sex, she's exposing herself to sexually transmitted infection. Likewise with the boys, you're not ready to be a parent at 14, at 15, at 18. You are not working. What are you going to feed with your children? Some of us, our brothers, were told, like, if you impregnate a girl and you are young, our support to you is a box of hoe. We give you, you go to your house. So our brothers, at least they feared, digging is hard. You dig for the rest of your life and you're feeding, you also having children that you will be feeding from the garden. It's hard. So they had to adhere and keep in school. And this helps a lot.
All right, thank you so much, Oyella. Yes, Data, I'm giving you both a chance in less than a minute to share your last messages, because we are left with 2 minutes to end with our show.
Thank you so much. My last message is addressing the intertwined issues of child marriage and obstetric fistula in South Sudan requires a multifaceted approach, which of course involves issues of legal reform, very important, issues of healthcare improvement, and of course community engagement for them to be able to know the impact of child marriage and what they can do in case of issues of obstetric fistula. And of course, by prioritizing the health and rights of women and girls, South Sudan can be able to move forward towards a future where such of course preventable tragedies are no longer a reality. So it's all about us as parents to be able to champion this in our communities. Don't wait for Oyella to come, don't wait for Data to come. Start from your families, in your communities, and in our societies all over South Sudan. Thank you.
Yes, Oyella.
Yeah, thank you so much. Data has already mentioned it, the strengthening of health system and justice. Me, I would go on the side of the community, or to improve on their health-seeking behavior. For example, when they have a pregnant adolescent, a pregnant young girl, this girl should be taken for antenatal. When she's sick, she should go for medical care. And also others, they should always seek medical attention in case of anything, and all births should be taken care of at health facility. Delivery should be at health facility, and they should go for care earlier enough, and they should listen to the advice of health workers because they understand what is happening. Thank you.
All right, thank you so much. Yes, Oyella Josephine, who is a project officer for sexual reproductive health and rights, and GBV with Amref Health Africa, and also Data Gordon, the Executive Director of Men for Women. Thank you for being part of the discussion today. And also I would love to appreciate our sign language interpreter, that is Adede Pascolin. Thank you, Listen of iRadio, for those who called in and watch our program live on Facebook. We meet again next Saturday on another discussion right here on the Zone 72. Have a nice evening.
It's a Baghdad Diamond Wenisuma iRadio ala numero ta telefon 09